Our case study about benign prostatic hyperplasia is about a 76-year-old man with a recent history of recurrent UTIs. He has been hospitalized 3 times in the last 2 years with acute pyelonephritis. Today, he presents with complaints of recent onset urinary frequency, urgency, occasional incontinence, and nocturia. Now, which urinary function tests are consistent with an enlarged prostate in this patient? All 3 genitourinary function tests conducted on this patient were abnormal and consistent with enlarged prostate. What do we have? We have a Qmax less than 10 mL per second, consistent with weak urinary stream, weak urinary flow, and this indicates some degree of urethral obstruction. We have residual urine volume, too much urine found in the bladder after voiding, more than 100 mL. This is considered high and indicates that the patient is retaining urine after voiding. And a bladder voiding pressure that is elevated, more than 60 centimeters water, also suggests urethral obstruction. Provide 3 strong lines of evidence that this patient does not have prostate cancer. And this is a common question. Is it BPH or a prostate cancer? Is it BPH or a prostate cancer? Now, the absence of distinct nodules and induration with palpation of the prostate during the digital rectal examination will kind of reassure you that this is not prostate cancer. In prostate cancer, you can feel by digital rectal exam, you can feel a distinct nodule that is kind of indurated, firm, that's suspicious, and this is when you want to do a biopsy. Remember, you're never sure about cancer diagnosis except by biopsy. What's the gold standard test for any cancer? It is biopsy. But when to suspect it is when you feel this distinct nodule. Also, the patient's prostatic specific antigen, the patient's PSA, is kind of within normal range for his age, and more importantly, it did not increase more than 0.75 nanogram per milliliter in the past year. What's important about the PSA? PSA is not, and I repeat, PSA is not a screening test for prostate cancer. But how can we make use of PSA? When it increases very fast over short duration of time, this should make you suspicious. This should make you test this patient, examine this patient by digital rectal exam, or do ultrasound guided biopsy and see what's going on inside this gland.